I'm pleased to talk to you today about what we can learn from the study of the history of medicine and science. This is a long-standing interest of mine, and I would like to be able to convince everybody that it's fun and it's also important. And my right lobe won't work. Right. This is the CME. The basic point is we tend to think of people in the past being stupid. They believed that the sun revolved around the earth. They believed only 100 years ago or so that you could treat disease by bleeding. And it's estimated that the year in which it was better to go to the doctor versus better than staying away was perhaps 1925. Before then, you were more likely to be hurt by the doctors. But the point is that the reason these people made so many mistakes, had some unreasonable beliefs, it's not because they were dumb. It's because they were not neurologically impaired. They just did the best they could at the time. And evolution has not progressed that fast. So people are not smarter now than they were 100 years ago. I mean, obviously, that's a big question, but evolution hasn't done this. So if we study the mistakes in the past, we can be more aware of what we might be mixing up or getting wrong today. Studying history helps to enhance our capacity for reason, critical thinking. Particularly important is the appreciation of stories. And thinking about history for science and medicine helps to understand events as part of a story. And the human brain evolved with the capacity for appreciation of stories. Hi, Martin. And this explains why there are so many movies available, why there's so many books. Agatha Christie has said that she has sold over 1 billion books. The issue can be illustrated here. You see this little one here who is not paying attention. Maybe this is Paleolithic scene 50,000 years ago. And there are 2 children, 3 children, several children, but the one standing on the right, on the left, standing on the left, perhaps he's paying attention to the story being told by an elder on the right. The one who's yawning, not paying attention. What I mean is genes which influence how attentive a child is could affect their survival. The ones who pay attention will be more likely to learn something from stories than the ones who don't pay attention. So they will have a survival advantage. That means that listening to stories is evolutionarily adaptive. So our brain is equipped by evolution to pay attention to stories, just like we pay attention unconsciously to our body temperature and heart rate and so on. So the brain evolved for a capacity for stories, and the more we think about things in a historical context, the more it becomes a story which makes it remember. So I would like to personalize this talk in a rather uncommon way, but this was one of my chairs when I was a resident. I had 2 chairs, one retired middle of my residency in New York at Mount Sinai. It was Morris Bender, who was replaced by Melvin Yarr, who was president of the ANA around that time. He taught a few things about Parkinson's and other things. First of all, he said Parkinson's did not affect cognition. That was believed at the time. He said there were no genetic factors for Parkinson and that cognitive neurology was not that important. Not saying that he would come out and say that, he just would not treat it as he wouldn't want to listen to a talk about aphasia. He thought it was a waste of time. And he was wrong about all these things. My first point is smart people make mistakes. And we need to know that today in case a neurosurgeon operates on the wrong side of the patient's head, which has happened. And I think it's an important principle for students to know that their professors can be wrong. Dr. Yar never had a patient he couldn't make a diagnosis. He was always sure, and he was never in doubt. He was often wrong, but never in doubt. He replaced Morris Bender, who would often say, "I'm just a boy." He was also president of the ANA. And at one time, he had 50 patients in the hospital, all his private patients, 50 patients at once. It was the residents would take care of them, of course. But you can imagine how much time he spent with each patient. But he had an enormous practice, and he had enormous experience and wrote over 300 papers. And if he saw a patient he didn't know, he'd say, "I don't know, I'm just a boy, I don't know." And he would admit, he would say, "It's a puzzlement." And actually, this is a very important stage in learning, is to admit to yourself and to others that you don't know. Because if you think you know, your inquiry will end or be inhibited by knowledge, which could be wrong. Similar to the quote that science is a photography of ignorance. Being aware of what we don't know is the first step for learning. When I was a resident, we had a attending who came from another prominent hospital in New York. And he just finished his training, and we presented the case to him. We were going on rounds, and the daily rounds, we presented this new case, and he would interrupt the presentation and said, "Oh, you should see the paper in Neurology Green Journal two months ago by Feldbaum, and it showed this, this, and this." And we said, "Well, thank you. And would you like to come? Let's go now. We're done with the presentation. Let's go see the patient." He said, "We don't need to see the patient. I already told you what it is." And this is a lack of awareness of uncertainty. It's important to acknowledge what you don't know. I asked a very unusual, maybe improper question at a neurology conference, the Alzheimer conference. They were discussing the Alzheimer new drugs, and there's the head of Eisai and the head of Pfizer in the room, the head of Alzheimer development for Eisai and Pfizer, and they're discussing the new drugs, which are this much effective. I said, "Could you please tell me, what do you think is the cause of Alzheimer's?" They were completely unprepared for such a difference. This is Jean-Marie Charcot, which is known for ALS and many, many other things, a great French professor, who said, "Let somebody say of a doctor that she really knows his physiology or anatomy. These are not real compliments. If you say she is an observer, a person who knows how to see, this is the greatest compliment." I hope the administration in Washington forgives me for changing the pronouns of this quote. But this is exactly what this fellow who didn't want to see the patient needs to know, that it's more important to pay attention to the patient than paying attention to the literature. Of course, we do pay attention to the literature, but we don't ignore the patient. So I'm going to make some presentations of ideas and thoughts and guidance and look at their historical context. One question for all of us is, how do we choose a subject for research? This is like really important for researchers. If you're going to work on this, you're going to work on something else. How do you decide? Consider the method of scientific reports. This is a journal published by Nature. There, I was on their editorial board, and their rule is it has to be correct. It doesn't have to be important. So they have this idea that basic science could be very valuable, even though it appears to be insignificant. The problem there is, this is why they published 22,000 articles in 2024. And each one is paying them $2,000 to $3,000. So they're making an enormous amount of money, and they're publishing a lot of papers. They will acknowledge they're just not important. So this is only my position. Not worth doing research if your subject is trivial. And a lot of research being done, always, but especially now maybe, is, I call it Himalayan research. They're doing it because they can. Why did Mallory and this other fellow, why do they want to climb Everest? Well, because it's there. So why are we doing this study of Alzheimer's disease, drawing clocks? Because they can. Especially a problem now where we can do single cell RNA sequencing. And the paper gets an enormous amount of data. And of course, they'll find a paper about it. This is best illustrated here. Imagine a researcher a neurologist, a pediatric neurologist, or any kind of neurologist in the 40s, and they could be addressing the use of the iron lung, or they could be growing poliovirus in egg yolk, in vitro in egg. And it turned out that the polio vaccine was started in 1955. And there were 29,000 cases of paralytic polio. Look how it fell. I mean, is that incredible? It's really incredible. It's wonderful. But thank goodness that NIH and other agencies were not focused primarily on iron lungs and ignored basic science. And here, I'm not implying that care of the patients is not important. It is, but some research questions are more important than others. So it's wise to test every concept, question you have. What difference will it make? What difference to anybody will the truth make? My position has always been, if it's not going to make any difference, maybe it's not worth doing. All right, how do you choose a mentor? What could we learn from history about how to choose? Choosing a mentor is really important. And I will put a personal aspect of this, but imagine this story. Albert St. Georgi is a Hungarian chemist who discovered vitamin C and won the Nobel Prize in 1937. He has a wonderful essay in a book of Annals of Science, Annual Review of Chemistry. And he said that his work was not going very well, and his mentor died, and he lacked support, and he had to go home to Hungary. This would have been in the 1920s. And he didn't want to go because he knew that he couldn't do science at that time in Hungary. So he went to a physiological conference in Stockholm, just as a last scientific thing of his career, and then he was going to go home and then hire scientifically and maybe teach. And he saw no chances, but he went to the International Physiological Congress in Stockholm, and he heard a talk by Sir Frederick Hopkins, who had discovered fat-soluble vitamins. And Hopkins said, "Why don't you come to Cambridge?" So because St. Georgi went to the conference and met this guy and had the nerve to go and talk to him, he ended up in Cambridge and ended up winning the Nobel Prize. So the idea is, for choosing a mentor, choosing a scientific problem, we all should be very aggressive, ambitious, and fearless. And perhaps it's improper of me to compare the story about myself to one about St. Georgi. But in 1980, I was in Berkeley. My research was not going well. And I went to a talk about PET scans, which was a new technology that I didn't know anything about. Presented in Berkeley by Tom Buttinger, who had just designed the best PET scanner in the world. And I went up to him after his talk and I introduced myself. He said, "I'm busy, come back on Thursday." All right, okay. I came on Thursday and he said, "Where are your slides?" I said, "What do you mean slides?" He said, "You're giving the lab meeting today." What? I'm not. So I just invented a talk. I discussed Alzheimer's disease. And his group were all statisticians, physicists, engineers. They said to me, what is Alzheimer's disease? And because I had the nerve to go to talk to this guy and ended up giving this talk without any warning, we worked together. We did the first studies on Alzheimer and PET scanning in the 80s. How do we choose the research subjects? We should understand that all models are wrong. However, some are useful. So it's good to be aware of the limitations of all models, like with this mouse or that mouse, or what you're doing in vitro or with Drosophila or whatever. So Albert St. Georgi again said later in his life that he was interested in pharmacology because the drugs were simple, but they really didn't relieve complexity. So he studied bacteria, but they were too complex. So he shifted to physiochemistry and then to chemistry and to molecules, but the molecules were too complicated. So he shifted to electrons, hoping to have reached bottom, but nature has no bottom. This is not a fantasy. He was working on the cure for cancer, or the cause of cancer was in the nucleus of the atom, because he thought humans are too complicated, mice are too much in cells and molecules, so everything is too much. This is like the far, far extreme of the idea of you gotta study things in the simplest way. And if you look at any issue of science or nature, you'll see the scientific field today is completely obsessed with mice. Humans are. I have a friend who had a grant rejected with the comment, "The human frontal lobe is too complex to study." That was, the reviewer said, "No funding because the human frontal lobe is too complex." But the idea here is there are pluses and minuses of every model, but we need to consider all of them when we choose our subjects and when we analyze our results. Consider Louis Pasteur. These are all the things he did. He discovered fermentation, stereochemistry, vaccines for rabies, cholera, and anthrax. He studied silkworms who were not growing well. He disproved spontaneous generation, pasteurization, germ theory of disease. So in terms of approach, his was quite broad, unfocused. And I have the thought experiment. Imagine Louis coming up for a promotion meeting of the Sorbonne, which is his university, promotion and tenure committee. And they review him and they say, "Dear Doctor, share Dr. Pasteur. The committee of promotion and tenure was disturbed to see the marked lack of focus in your work. Also, you have received a lot of funding, but most of it is from industry, which is not good." So again, when we choose a research subject, we need to be focused. You need, in order to be funded, in order to have conclusions, in order to have results and papers and grants, you need to have focus. But there's an amount of focus which is excessive, an amount of focus which is inadequate also. So what you need to do is to find the middle road where you'll have focus, without being ignorant for everything else happening in the field. Now, here's another question informed by history. What determines success? According to Louis, he said, let me tell you the secret that led to my goal. My sole strength is in my tenacity. So there's a tendency for us to idealize people in the past, especially like, or who did so many wonderful things. But the reason, according to him, wasn't because he was really smart. Undoubtedly, he was really smart, but he says what led him to his goal was his tenacity. So really working hard is more important than intelligence. There's a story about the reason why there are so many people who went to very, very distinguished institutions and didn't have a very productive life later, even though you think, when you think about where they studied, you think they should have been more accomplished. The reason is that they have a really, really good memory. So when they went to school, they could go to a class and hear a lecture about alkene chemistry and remember everything just by being there in the room. But that allowed them to succeed and allowed them to get into difficult Ivy League colleges, get grants and fellowships. But then when it comes to work, they didn't have to work hard in order to succeed. So in order to be successful in science, you need to work hard. And memory, having brilliant memory, will not help if you don't know how to work hard. So to answer my question, success is determined by hard work. Let's consider what happened with Alzheimer. He was a friend of Bielszowski and Nissl, and they designed stains which he used. We tend to forget about this, but in the early 19th century, they didn't know much about the brain because they didn't have the right stains. If you look at the brain with a microscope, if you don't have a stain, you can't see much. You can't see neurons just because you're looking at the brain. You need to have stains. And it was Alzheimer who stained the brain using silver stains from Bielszowski and also Nissl. This is Alzheimer's dissertation on orange maltodextrin, which is earwax. So another principle you could get from history is you can't judge a scientist by what they do when they're dissertation. He gave a paper in 1905, which was published in 1906, about the Alzheimer case. They say at this meeting, it was the only case that had no discussion. And he was only able to succeed because of his friendship with Bielszowski. So the general principle there is friends can be really important for science. And both Bielszowski and Alzheimer worked with Weigert. And he was the first to stain bacteria, important for recovery of TB. And it said that he died a disappointed man, for he never became a full professor. This was not only because he was Jewish, because he lacked the self-assurance needed to fill the role. It's very rare you actually learn about somebody else's personality who died such a long time ago. And this is really not important, but it helps to put it into it helps to personalize it, makes it more convincing story, interesting story. They both worked with von Guten, and he described the optic chiasm. Von Guten is best known for the fact that he was murdered by King Ludwig II. And so, of course, this is a story, but a story which is really not important for the history of science. But look how King Ludwig changed in these few years. 12 years to 1884, he gained an enormous amount of weight. He was maybe schizophrenic, but when he invited his horse into the royal dining room and the horse broke some of the royal china, that was too much. He was acting strange. When he did that, they removed his power, and he was trying to kill himself in the lake near the castle when Van Guten was arriving in a carriage, and Van Guten went to rescue him. They both died. Alzheimer's work was dependent on his friends, but also on Mrs. Grumbach, who is shown in the middle. They say that she taught technology, histology to Alzheimer. And it's been said if it wasn't for the fact she was a woman, we'd all be calling it Grumbach's disease. And on the extreme right of the picture is Frederick Louis, who's trying to squeeze his body into the picture. Alzheimer's in the back. Fisher actually described the plaque before Alzheimer. Emil Kraepelin was the boss of Alzheimer and was the head of the most distinguished psychiatric facility in the world at that time. And he chose Alzheimer as the name of the disease. It's believed he did that because he wanted to enhance the fame of his own department, institute, because he could have named it after Pick or Fisher, but he didn't. And in 1920, he wrote a paper called Self-Assessment, where he turned his diagnostic methods upon himself and documented the state of his own mind. Like item number 2 might have been, I like to write. Item number 3 is, I like to travel. Item number 26, I hate the Jews. And what's remarkable about it is not that he was anti-Semitic, but that he wanted to tell everybody, and he wanted everybody to know. I mean, he died 5 years later. It was important, and he said that it's important for everybody to know that. But what he didn't like was that they were so successful. That was it. I think it's very interesting to learn how racism develops. And it has a lot of implications for what's happening today in this country. So Kraepelin named the disease after Alzheimer. He could have named it after these other people. Particularly Perricini published the first papers on Alzheimer's disease with figures in 1910. And in Italy, for years, they called it Perricini's disease. So Kraepelin said Alzheimer was presenile because that was Alzheimer's cases. They completely ignored the more common appearance of Alzheimer in older persons, which was called senile psychosis or dementia, senile dementia. They just ignored it. And they thought it was caused by atherosclerosis, which was, this is the view that was held for more than 50 years. So another principle here about history is wrong ideas can go on forever. It takes a long time to change such an. So even as late as 87, they said dementia is grave and irreversible. That's wrong. Now, if you fall off a truck, you might have a head injury and have dementia, but you could get better, especially if the subdural hematomas are removed. So dementia is not always grave, not always irreversible. It does not necessarily imply some degree of permanent change. I worked with Robert Katzman at Einstein, New York, for 1 year. And in 1976, he wrote a very important paper in Archives about the prevalence and malignancy of Alzheimer. He pointed out the fact, which was obvious to everybody, but hadn't been pointed out directly, that the commonest cause of dementia in older persons is the same disease as what occurs in younger people before the age of 65. So the presenile and senile dementia are the same thing. Of course, there are various genes which can cause presenile dementia, which is something else. And this changed the way the disease was framed. And I admit I stole this paper from ChatGPT. It just showed up, and I wasn't looking for a picture of an elephant, but it just There it is. I couldn't resist the color of that eye. But framing is how you present something. So before it was framed as senile dementia is a disease of old people, and people didn't care about old people in those days, 60s and 70s, and before. Enormous bias against the disease. Wrong beliefs can take a long time. The key thing here to show about how some things are more important than others is this paper by Glenner and Wang, 1984. They sequenced the amyloid protein, the first 25 amino acids. This paper has been cited almost 500 times in the past 40 years or more, even though it was published in BBRC, which is a very, very low impact journal. So the quality of the journal is not often the most important thing. What's important is what you're saying, what you have to say. Alzheimer was very forward-thinking, also in his hobby of tennis. Particularly, you'll note he was using modern rackets back in 1910. He's the one in the middle. And Alzheimer and Krepelin, Galp and Nissel had appreciation for antioxidants in blueberries. This is the only picture of Nissel, who was the guy on the first far right, that shows a vascular deformity of his face. I forgot the name of this kind of a stain. And all the other pictures show only his right profile. We should be aware of the black swan, which is something which hasn't happened before. Because we think about our reasoning is managed always by our experience. So imagine what happened to Gajdusek when he went to New Guinea in the 50s, 60s, and examined cases of Kuru. They wanted to see what was the cause, which was a neurological disease. Now we know it's a prion disease. Was it genetic, infectious, toxic, nutritional, or these other causes? They investigated everything, and they didn't find the cause. A veterinary neuropathologist in England published this paper, I think it was 1955. Look at this sentence. While attempts to draw too close an analogy between diseases of man and lower animals are attended by numerous pitfalls, many valuable clues contributing to the understanding of a fundamental nature can be gained from a broad comparative viewpoint. You want to go, yes. And they showed that here on the left is Kuru, on the right, on the far right is Grapey. Grapey is a disease well known for decades in sheep, and it has the same pathology with hypertrophy of astrocytes and spongiform degeneration. Grapey is known to be transmissible. So when Gajdusek learned about this, he collected brain specimens and sent them to his lab at NIH and showed that that Kuru is transmissible. Also Kurzfeld, that's another story altogether. The only reason he could do that is he had an NIH lab and he didn't need to write grants. He had a budget of like $5 million a year. And he won the Nobel Prize in 1976 for this. What's remarkable is the chimpanzees that were involved in that experiment were thanked by name in the brain paper. The authors would like to thank Daisy and Georgette for their contribution. Okay, Carl Wernicke of Wernicke's encephalopathy, he died of a bike accident, 56. I've often wondered, why do I find this interesting? Right, so I'll tell you, all your students, this will not be on the board. Like, why did Carl Wernicke die? Well, how did Carl Wernicke die? Why is this worth remembering? Two reasons are, over 50% of cases of Wernicke's encephalopathy die without being recognized during life. And it's completely treatable. But it's not very current. So undoubtedly, the owner of vitamin B1 is not going to send us big expert here next week to give us a talk about thiamine and thiamine and thiamine. And we don't have any pens with thiamine on it because nobody can make any money selling such a vitamin. So we tend to not remember Wernicke's. So whatever we can be done, and this is my theory, you know, thinking about him dying in a bike accident, maybe next time you see a patient who has nystagmus and dizziness, maybe alcoholic or whatever. Also, Pierre Curie, Patricia Goldman-Rakich, and Paul Schilder of Schilder's disease, they all died as pedestrians. A U of L professor died in a car accident, hit by a car about 6 months ago in the School of Public Health. So I think this is an occupational hazard for people who are likely to be crossing the street while they're thinking about their grant or their paper or their patient, and they're not noticing the bus that's coming around the corner. So that's another reason why we should remember Carl Wernicke, how he died. In particular, we also tend to think that what's important for research is being technically sophisticated. And this is, of course, true in some ways, like if you want to get a grant from NIH, you have to show you can do this, you can do all these various new modern techniques, single-cell RNA sequencing and so on. However, not necessary all the time. Examples are Parkinson himself, who described the disease in 1887 without any mice and without any autopsies. And Roy and Sherrington wrote a paper on the blood supply of the brain and how it's regulated by neuronal activity. This is in 1890. And he applied this device to the skull of dogs. And then he took the brain, the head of a dog, and put it in an oven for half an hour and ground up the brain and injected this in this other dog, which has this device on it. And he showed that the products of metabolism in the baked dog brain increased blood flow. And he got the idea that blood flow was related to neuronal activity, which is true. But I can't think of a more gross and unsophisticated method, but it worked for him. He also said that blood pressure is directly related to blood flow, which of course is wrong. And this view survived for more than 50 years. He didn't know about autoregulation. He could have discovered it, but probably the drugs they gave to these dogs were so affected that. So advanced sophisticated methods are really, really good, but they're not necessary all the time. And that is the general principle of my talk, is when we think about history, we should think these people those days, they did such wonderful things, and they didn't have X-ray crystallography, and they didn't have DNA sequencing. How did they do it? And smart people make mistakes. My favorite example is Galileo. He said that tides were not caused by the moon. At Duke, this poor woman died after a heart transplant. She was given a heart with the wrong blood type. And Linus Pauling, who won 2 Nobel Prizes, said that the DNA structure was a triple helix. You want to go like, oh, close. And then this is something I find, I don't know, it's fascinating. Rudolf Virchow is like one of the greatest pathologists of all time. He wrote Cellular Pathology in like 1860 or something, this great book showing that the cell is the fundamental unit of life and the father of pathology. And he didn't like Louis Pasteur. He rejected the germ theory because it didn't fit with his theory about miasma and odors or humors. So this helps to teach us that we can't accept the views of anybody just because, oh, he's a professor at Yale. or he's a great, very distinguished, he's written 800 papers, he could still be wrong. And I'd like history is filled with lessons of bias. The hard part about preparing this talk is there's so many things I could say about each issue, but I had to pick something, and things I couldn't say everything. Rosalind Yalow was a scientist actually at Einstein in the Bronx where I worked, and she won the Nobel Prize for radioimmunoassay in 1977. Her first lab was in the closet at the Bronx VA hospital. When she was accepted for a physics position in University of Champaign, Indiana, she was also studying stenography, but stopped her stenography classes when she got into graduate school. She was the only woman in 400 students. I recommend Nobel Lectures, which is online, of course, has a lecture about everybody who ever won a Nobel. And you can just read these stories about people's life. And what is irresistible to tell you all about is in her Nobel lecture, which was published in Science, she included a copy of the rejection for her, one of her most important papers. So Stanley Bradley, who will forever be known by as the one who mistakenly rejected a paper by Rosalind Yalow that won the Nobel Prize, he said, "I regret to say your paper, experts in the field have been particularly emphatic in rejecting your positive statement," so on and so on and so on. But the immunoassay is used all over the world. There are literally thousands and thousands of discoveries related to this. So the forms of bias are deserving of course, of a book, but this is an example of bias against gender, bias concerning gender, and the bias of new ideas. William James, the great Boston Harvard psychologist, said, "A great many people think they're thinking. They're just rearranging their prejudices." I'm nearing the conclusion, but I want to discuss how a career path can be chosen. And sometimes it's chosen for us. So, okay, we go to elementary school, we go to junior high school, we go to high school, then if we're lucky, we go to college. You want to be a neurologist, you go to medical school, you go to neurology residency, and you become an assistant professor somewhere, or you do a fellowship, and then you can one day be a professor. My point is, it's valuable to consider all the options. And at each point, you need to make the right choices. And I have two examples of how your choice of options may be broadened. And myself, I got to know Gajdusek from a friend of mine in the 70s, and I considered going to New Guinea. But I didn't go, and why I didn't go is another matter. It's not important, but at least it's something I could have done. I could have not done my fellowship, or I could have done my fellowship in New Guinea. But consider Solomon Carter Fuller, who was a Liberian who came to America and went to medical school at Boston University. And he was a pathologist. And sometime late in the maybe 1900, he realized he didn't know much about pathology, and he wanted to learn about it. So he went to work with Alzheimer's. I mean, I can't imagine the courage of someone to go from Liberia to Boston to Germany. And here he is in the center of this picture with Alzheimer's to his left there. And he wrote some of the most important papers about Alzheimer's disease. So my principle here is look for the best options possible. Don't think, well, I don't want to go work for that guy. He's too good, or he's too published, or he's too famous. Search for the best opportunity and choose your own path. This is illustrated by the next two people, which was near my conclusion. He was Alsatian, and he was a physician, and he was working in Africa. He said he was in a boat on the river. He was near Gabon in West Africa. Slowly we crept upstream, struggling to find the elementary and universal conception of the ethical, which I had not discovered in any philosophy. He was a philosopher as well as a physician and evangelist. He said, later on the third day, at the very moment when at sunset we were making our way through a herd of hippopotamuses, there flashed upon my mind, unforeseen and unsought, the phrase, reverence for life. The iron door had yielded, the path in the thicket had become visible. Now I have found my way to the idea in which world and life affirmation and ethics are contained. Now I knew that the worldview of ethical world and life affirmation, together with its ideals, is founded in thought. And he devoted the rest of his life to care of these people, this community in Africa, where he died, I don't know, 40 years later. And it's important to know about these kind of people and these ideas that we can broaden our career path if we have more imagination about what could be done. Why he went and did this, and most other people who grew up with him were happy to have their practices in Germany and France. Finally, consider this story about Gwen Mellon and Larry Mellon. So he was an heir of the Mellon fortune, which has something to do with Pittsburgh. And in the 40s, they were living perfectly happily in California. And she was very concerned with horses. Like very many wealthy women, they like to take care of and ride horses and teach horses how to walk like this, all those things like that. And she had a lot of money. They read about Albert Schweitzer's books. He wrote several books. And they went to Africa to meet him. And he convinced them to come and do something similar. So Larry went to medical school and became a doctor. And Gwen Mellon, his wife, became a nurse. And they went to Haiti and they opened the hospital, Albert Schweitzer in Haiti in 1956. Supported by his money. And what I find most remarkable is that she died there at the age of 89 in the year 2000. I can understand that they made a wonderful gift and they created a hospital, which is a wonderful thing. And then she went home and she died and continued to support the hospital. But she was there all that time running the hospital. So this is incredible. What is it about these people who can have such incredible dedication? And this is another kind of opportunity we have when we think about, I don't want people to be limited to think, well, okay, my options are, I can go to Pittsburgh and do a fellowship, or I could go to, there's another one in Cincinnati, which is better because it's near my sister-in-law. Just consider what the possibilities are. So in conclusion, and I'd be very happy to have your questions. History is fun and relevant. So it's particularly interesting to read the original accounts of things, to read the original papers, to learn about things directly, not only about what somebody said about something. And humans have not evolved cognitively past 2,000 years. So we can learn about how people think from history and understand that smart people make mistakes. And there are no disciplines. So why was Pasteur working on all these different topics when he was a chemist? And people confronted him with this at the time. They said, look at Louis, you're a chemist. Why are you working on anthrax? That's nothing to do. But he didn't matter to him. What mattered to him was how people were suffering. Much of what we know is wrong, and everyone is biased. What's important is not to be free of bias, but to be aware of, because there's some component of biases is unavoidable. Like if I was interviewing a neurology residency candidate and he came with short pants and slippers, I would be wondering about his competence for neurology residency. But that's a bias. So we all have certain biases. We need to be aware of it. And I discussed several of these things in my second book, 99 Lessons, and I will be very happy to answer your questions. Any question online? Ruma?
Hello.
Ruma's from Cambridge. Sorry, I didn't have time for Max Perutz.
That's okay. It's lovely, very good lecture. You cover so much.
I'm sorry, can you maybe if you move farther away from your microphone?
Okay, can you hear me now?
Yes.
It's too much noise. Yeah. Sorry.
Know what to do? Yes, Ruma, could you close one of your two windows? You're connected twice.
I can't see. Okay. I got too many.
Ruma, just close one of your. I do it.
Right. Sorry, Rob.
Okay, we'll talk later.
Yeah,
We'll talk
yeah,
later.
Later. Yeah.
Okay, Ruma, how about now? You have a question?
Yes, I think it is very important. Can you hear me now?
Yes.
It is very important that we must read some history, and then you remember that what is the other person did and what inspiration you can get it from. Okay, it is very important, not just learning a disease and what is the pathology. It's always the science and the knowledge behind. Max Perutz always is to tell me the story about everything. If I ask him something, he say, okay, we talk about how that things happen. It's very important. And I think your lecture is very nice. I hope your student will follow that.
Thank you.
Thank you.
No questions from this room. Yes. Right. The general position in bioethics is such data cannot be used. And I think the reality is they didn't do it anything very well. So even if you did want to do it, they didn't have appropriate controls, and they were lousy scientists. Aside from being criminals and murderers, they were not good scientists. And I could have included that in here. There was a German neurologist who participated in that, and Julius Hallervorden, who described Hallervorden-Spatz disease. And when it came out in the 90s that Hallervorden did these encouraged the murder of healthy German children who were disabled, when that came out, it was said that, well, they should stop calling it Hallervorden's disease. And I wrote a letter to Neurology and said we should not call it Hallervorden-Spatz disease, and we should call it Spatz disease, S-P-A-T-Z. But you all know what was wrong with that idea. Spatz was a Nazi too. That came out later. So now it has a very long name, which describes the pathology. But they weren't good scientists, aside from their murderous activities. So I don't think there was any valuable data to be gotten. Okay, my final comment is I encourage everyone here to be careful to have clean socks, because we all stand on the shoulders of giants. And it'd be rude to stand on the shoulders of giants wearing shoes. So also, if you're going to stand on, Louis Pasteur's shoulders, you have make sure your socks are clean. And I identify who you admire the most. And so personally, I will admit I'm nearly obsessed with Louis Pasteur. The idea that he would work with rabies before viruses were discovered. So I have a picture of him in the lab with cages, dogs. And this one is going to be, inoculated last month, and this one is going to be inoculated tomorrow. And they take the rabid animals and grind up the brain and give them to the areas in the room with these. And there's no treatment for rabies right? So and he developed a vaccine which was used until the 1950s. So I can't imagine how perceptive and forward-thinking he was. The other lesson from him, of course, is if you have don't be limited by the fact that you're a neurologist, consider what you might contribute, even if you're not exactly the right specialty or subspecialty. Thank you very much.